Somewhere, thousands of years ago, a person had a hole drilled into their skull while fully awake. And they survived. Not once, but according to the bone evidence, some people had it done to them more than once. Here's what nobody tells you. Ancient humans weren't just crudely hacking at each other and hoping for the best. Some of them were performing actual surgery with real technique, real survival rates, and absolutely nothing for the pain. Let's start with the skull drilling because it's the wildest one. It's called trepanning, cutting, or scraping a hole directly into someone's skull, and it's one of the oldest known surgical procedures on Earth. Archaeologists have found skulls with these holes where the bone had clearly started healing afterward. Healing means one thing. The patient didn't just survive the surgery, they lived long enough afterward for their body to repair itself. Nobody knows for certain why they did it. Some researchers think it treated head injuries or seizures. Others think it was meant to release something believed to be trapped inside the skull. Either way, someone had to hold a sharp tool against another conscious person's head and start cutting, on purpose, with a plan. And here's the part that should genuinely unsettle you. Some skulls show multiple healed holes, meaning some people survived this more than once. Here's a number that puts this in perspective. In some ancient burial sites, researchers estimate the survival rate of trepanning at somewhere around 50 to 70%, based purely on how many skulls show healed bone versus none at all. For a surgery performed with stone tools and no sterilization, that's a shockingly high number. So what did ancient surgeons actually use for pain relief? Basically nothing close to modern anesthesia. Alcohol, when available, dulled the senses a little. Certain plants had mild numbing or sedative properties, opium being one of the earliest and most effective options once it was discovered. Sometimes it came down to nothing more sophisticated than a few people holding the patient down as tightly as possible. That's it. That was the entire pain management plan for actual surgery. Amputation is where this gets even more intense. Removing a limb was one of the only ways to stop certain infections from spreading and killing someone entirely. The biggest danger was never really the cutting itself, it was bleeding out afterward. So ancient surgeons developed real methods to stop it, pressing hot metal or fire directly against the wound to seal it shut, a method called cauterization. Brutal, yes. But it worked well enough that people regularly survived it. Here's a fact that should surprise you. Archaeological evidence shows ancient amputees who survived for years afterward, walking around on healed stumps, sometimes even using early prosthetic replacements. One preserved Egyptian prosthetic toe, made from wood and leather, shows genuine wear marks from actual walking, meaning someone used it as a real functioning body part for years, not just decoration for burial. This wasn't guesswork. It was medicine, functioning without modern tools, refined the hard way, through trial, error, and consequences that were brutally immediate. Speed mattered enormously. A skilled ancient surgeon could complete an amputation in under a minute, not for dramatic effect, but because every extra second was more blood lost and more agony endured. Fast wasn't optional. Fast was survival. Split here for second generation. Ancient surgeons also understood infection risk long before anyone understood germs. Some cultures cleaned wounds with wine or vinegar, which completely by accident actually has real antiseptic properties. They didn't know why it worked, they just noticed that wounds cleaned that way tended to heal better than wounds that weren't, and they kept doing it. Some ancient cultures also used honey to dress wounds, and this one genuinely holds up under modern testing. Honey has natural antibacterial properties, low moisture content that bacteria struggle to survive in, and it was used as a wound covering across multiple ancient civilizations independently, thousands of years before anyone understood what bacteria even were. Dental work existed too, and it's somehow just as intense. Archaeologists have found ancient teeth with tiny holes drilled directly into them, matching the exact size and shape of a cavity, filled with a substance to stop the pain and decay from spreading further. Someone, thousands of years ago, sat completely still while another person drilled into their tooth on purpose, fully conscious, and walked away afterward. Even eye surgery existed in some form. Ancient texts describe procedures to treat cataracts, using a technique that involved pushing the clouded lens out of the way inside the eye itself, restoring at least partial vision. No microscopes, no sterile tools. Just an understanding, built purely through observation of what was physically blocking someone's sight. None of this means ancient surgery was safe by modern standards. Let's be honest about that. Infection killed people constantly. Survival rates were nowhere close to what they are today, and plenty of patients didn't make it. This isn't a story about ancient medicine secretly outperforming modern medicine. It's a story about how far necessity can push innovation, even with almost nothing to work with. And here's the part that actually connects to you. Every modern surgery, every stitch, every anesthetic, every clean surgical tool traces its history directly back to people who were willing to cut into another human being with absolutely nothing to numb the pain, just knowledge, steady hands, and no other option. So next time you go in for a routine procedure, numbed, asleep, barely feeling a thing, remember what came before that. Someone, a very long time ago, held a blade to another person's skin with nothing but skill and nerve, and somehow, against every odd, medicine survived long enough to become what it is today.